Good morning, everyone. Dr. Jen from Wellness in 2 Words here, and I am making a video today with the 2-word phrase of mask up. Now, wait, before you decide to go, I don't want to wear a mask, and I'm just going to fast forward and not watch this video, I want you to kind of hear me out, okay? Because at first I was very like, I don't see how that would help. I just, and that doesn't make sense. And I'm very anti being told what to do. I'm not antisocial. I'm just very much, I believe in individual liberty and freedom. So when it comes to mandating things, I'm very resistant. So I want you to kind of hear me out on the phrase when I say that the wellness in 2 words phrase is mask up. And I'm going to tell you why, because I think this has become a political conversation. It has become a highly charged emotional conversation. And it was interesting, and I'm not going to quote Yahoo for science, but in a Yahoo article, it was like an op-ed piece, they said, in Hong Kong, wearing a mask is about as political as using an umbrella in the rain, which, they're basically like high population density, lots of potential for smog and pollutants and toxins and those kind of things. So as a general rule, it's not weird. It's actually fairly commonplace to wear a mask in a lot of Asian cultures because of the population density and other issues, environmental issues. But also just for the fact that when an illness like this does strike, it can be a very effective tool in slowing or eliminating the spread of disease. So I'm going to tell you why, because in my mind, again, those who know me know that I can be resistant to being told what to do. So I'm going to lead with science on this one because I think I've got right over here a whole little stack of papers. I don't get paid to do this. The whole point of doing this is to help educate you so that you learn how to understand biology and how to protect yourself. So I've looked through these papers. It's pretty compelling evidence. There's some modeling in here, theoretical modeling, but there's also just evidence-based stuff, not only with what seems to be the case emerging with SARS-CoV-2, but also what they looked at with SARS. Now keep in mind, SARS had far fewer cases of it, far less transmission, but it had potential to become an even larger pandemic than what it was. So when you think of pandemic potential, we've outpaced flu already. We've definitely put the original SARS to shame with this one. So keep in mind, some of this evidence is based on that. So let me go ahead and read a little bit here. Pardon the glare. I think we're at another crucial window of opportunity. And a lot of the evidence does show this, that the longer you wait to institute these kind of measures, the less effective they become. So when we're at a window of opportunity, keep in mind we had a window of opportunity for containment for COVID, and that didn't happen. So now we're in the mitigation phase where we're just trying to manage and minimize the damage. If you're trying to minimize the damage, limiting the spread is one of those things to do. And for people who deny that this virus is real, I can't help you on that one. It is very definitely real. ER doctors across the country are not manufacturing it or making it up. When it comes to counting the tests, I know there's some controversy about that. I don't think they're being double counted. I'm currently a hospice physician as well, so when it comes to filling out a death certificate, I'm extremely careful about declaring whether or not it would be a COVID illness, because unless they've had a positive test, unless I think there's compelling evidence that it is a COVID-related illness, I'm going back to the initial comorbidities. So the government hasn't sent me an email recommending that I, count things as COVID when they're not, or anything like that, knowing that I'm a physician who completes death certificates. So I think people have to be really careful when it comes to conspiracy, because a lot of these notions that people have about what doctors are doing or how tests are being counted, frankly, are just false. I mean, we document what we see. If a patient had a positive test and we think it contributed to their death, then obviously we're going to mark that up as a COVID illness. If we weren't sure, then most people typically don't do that. Only like really lazy doctors would do that. So just keep that in mind. I don't think any of that's being artificially inflated. And also keep in mind that when we look at testing numbers, if we compare this month to last month, knowing that in general testing didn't slow down, testing was about the same frequency, it was available to people who thought they were symptomatic or people who are asymptomatic who wanted to be sure, just random cross sections on some of those things. If the testing frequency and regional spread was about the same, and we're doing roughly the same number of tests or even slightly more than what we were before, but we're seeing a larger percentage of positive tests, which is what we are seeing. That is clearly indicating spread, increased spread. Because if your testing frequency is roughly the same, slightly a little bit higher, but not like crazy higher, and then you're seeing a larger percentage of positive tests, keep in mind hospitalizations and deaths will follow. So the whole reason behind this, the whole Mask Up initiative, and I live in a county right now where they're making it, the mandate is effective as of today. So there have been a couple times I've gone out without a mask, and frankly, I'll tell you, I felt a little weird, and I felt like what I was doing was wrong. And that's not brainwashing. I was looking around and going, you know what? There are a lot of people out right now, and if we want to be able to open up, we really have to embrace the philosophy of, if we can get out and be among each other, even though we're socially distancing, because you still need to do that in spite of wearing a mask. But if we're socially distancing and wearing a mask, it just makes sense that if the science supports that it eliminates or markedly decreases disease transmission and droplet spread, we all should be doing it, period. And it's easy. It's not like it's expensive. It's not exclusive. It doesn't cause any discomfort other than just the irritation of it. So I'm going to kind of walk you through that real quick, okay? All right. So Tennessee and Knoxville in particular passed the ordinance that, and this is one of the things with this that I do disagree with, that is a misdemeanor, and the class misdemeanor that it is means that if you're not in compliance, you can be put in jail for 30 days. I was like, great, that's a great way for me to catch COVID, if you get my drift. You're not going to be protected adequately in places like that. So either you would be put in jail for 30 days or it's a $50 fine. So, and then they hinted after all the uproar and protest from people that they wouldn't really enforce it anyway. So like it's completely makes no sense. I'm so not a rule follower. So it's like, well, what was the point of that? You said that it's this offense, but you're not really going to enforce it. So how is it that it's really a legit ordinance? Our mandate? I don't understand. So here's what I'm going to say. Regardless of what your government tells you to do, I'm going to tell you the compelling science, why you should be wearing a mask when you go out in public places. Okay, if you're not within your family cohort, which is your immediate family unit, or the people that you're keeping very close contact with on a daily basis that you try to distance as best you can, then you should be wearing a mask. Okay, so one of the modeling studies, and I'm going to put all these links in the comments. I've been really bad about doing that, but I'm going to do that for this. One of these studies here actually said if 80%, not 100%, but if 80% of the people would do it, you could actually get to, based on their modeling and statistics, and I'm not a math nerd, you could get to the point where you could actually eliminate transmission of disease. Now, keep in mind, that was within a 50-day window of the onset of an outbreak, okay? So there are a lot of people who are like, oh, second wave, first wave. Tennessee is still in the first wave. We haven't had sufficient numbers to even call it a significant wave. So we're still in our first wave. So we're actually in the middle of a window of opportunity in our community that if everybody would start wearing masks, and I know people don't like it. I hate it. I hate it. Oh my gosh, I hate it. But if we would start wearing masks, we might actually be able to reverse the whole spread of disease in our area. That's huge. Okay, sorry about the glare. And here's the other thing. There's a lot of false information about masks that's out on the internet that it just makes me cringe because they're saying things like it increases your CO2 levels or it drops your oxygen levels or it traps bacteria. Well, yeah, if it's gnarly and it's crammed down in your purse and it's got visible dirt all over it, sure, I wouldn't put that on my face either. But doctors, nurses, techs, all kinds of people in the medical community, we wear masks. We don't drop dead of elevated carbon dioxide levels or hypoxemia and low oxygen. People wear them for hours in the operating room. Yeah, they switch them out and they take breaks in between surgeries, but your body is built to extract oxygen from an environment that only has 21% ambient air oxygen concentration anyway. So unless you are grossly deficient in your hemoglobin, like anemic, you're not going to have any hard time finding plenty of oxygen, even if there's a mask over your face. So the people in our county who were exempt from it are people who are under the age of 5, obviously for safety reasons, people who were unable to remove a mask on their own without help. Okay, so elderly people who may be confused, probably not the best idea. And the places that they exempted were nursing homes, long-term care facilities, places like that, which are already on lockdown or very limited visitation. And so they're already sufficiently cohorted in that regard that they're kind of keeping to themselves, which is the other part of that is extremely sad. Like if we could get to the point where we could limit transmission of this disease to the point where we could ease other measures, people could start visiting their family members in some of these facilities. Some people are out there and they feel like their families abandoned them, they're lost, they're confused, they're dying alone or with very, very limited family contact, and it's just extremely sad. So residents in those places are being exempt from having to wear a mask because it frankly would be very difficult to get them to be compliant with it. But they're already isolated effectively from community spread as best we can in the first place. So other places are public places that are the government, and I didn't understand exactly why they're doing that, and I think it has to do with the hierarchy of government. In other words, which tier of government's kind of overruling which one, and it's basically a policy issue. But private homes are exempt, churches are exempt, places like that are exempt from having to wear a mask in general from this ordinance. Okay, so here's reason number one. It's not just science. There are people who, since we went on quarantine and now we've eased quarantine and they're back out in the community, that their jobs were at stake to begin with. We weren't even sure how soon we were going to open up. So those businesses took a huge hit, right? Now those people are coming back and they're trying to earn a livelihood. And if we don't contain spread this go round, we're going to have a longer lockdown, which means a lot of those people in those businesses will definitely lose their job. So if you want to support the local economy and actually help us get back on track sooner, I'm wearing a mask when I go out in these businesses because those people don't have a choice. They have to get to work. They have to be able to make a living. If they don't, they'll lose their job and they could be homeless. So since they have to show up to work and we want to support their business growing and being able to survive, it makes sense I would wear a mask because that way we get back to normal faster, period. That's not a political choice. That's a personal choice to say, you don't have a choice to have to be at work because you have to be able to earn a living. I need something from your business or whatever. I want to support you, but let's both wear a mask and keep our distance so that we can get back on track, period. It's out of respect for them. Now, let's get to the fun part, the science and the disease transmission. So, and the other thing too, if you're claustrophobic, I get it. If you've had trauma and you can't have something over your face, I completely understand. However, I think that's a personal decision. And I understand the whole concept of claustrophobia. We used to have patients who would come into the emergency room and they'd think, I have the flu, I might have the flu. They would go in the exam room and nobody's wearing a mask. It was like, oh my gosh, could we at least put a mask on this person? And then they would say, oh, I'm claustrophobic, I can't do it. If your oxygen level's fine and you come in and tell me you think you have an infectious disease and you refuse to wear a mask, I can't tell you how infuriating that is as a physician. That all of us walk around wearing masks and you're the one sitting there coughing and hacking and spreading it everywhere in the room for the next person to get exposed to potentially if we don't do an adequate deep clean. Anyway, that's a soapbox. Okay, so kind of refuting the whole thing about masks in terms of, obviously masks shouldn't have an exhalation port because then you might as well just shoot at me with a spitball through a straw. I mean, because then you're just channeling all your respiratory droplets that you were exhaling through the port. So masks that have exhalation ports, they're worthless, if you ask me, if you're talking about trying to prevent disease transmission. But they don't trap carbon dioxide, they just trap humidified air. They don't limit your oxygen intake. You shouldn't get one with an exhalation port. And the different ratings on them, some of the studies in here have shown that surgical masks are more effective in terms of containing droplets. In other words, being the blotter to kind of keep them from getting through the mask. So when we're talking about filtration, we're not talking about filtering micron particles, these tiny, tiny little micron particles that are the size of the virus. We're talking about preventing big globs of your exhaled stuff from getting out into the environment. That's why they're effective. And even cloth masks made at home are very effective in terms of containing the spread. I'm going to link to a video down here that shows you when they did a simulated sneeze and cough with a dummy and then exhaled particles, all the different things that could affect it and how the different masks could actually contain it and stop it. So that if you were to keep your distance 6 feet, even 12 feet would be ideal, but that's not really feasible for most people. But if you're to keep your distance at least 6 feet and wear a mask, how much difference that makes in terms of what's floating out in the air in front of you for you to breathe in. And if the other person has a mask on and then they breathe that in, then at least there's some element of filtration there. Now someone said, well, that's like a mosquito getting through chicken wire. Well, okay, I see your point. However, I'm not sneezing and coughing behind my mask, I'm merely talking. And so there are certain diphthongs that when you say, you put more droplet particles out there into the world to be inhaled in. However, if you limit, let's just do, I don't have a figure in here to kind of support that, 95% of them. If you limit 95% of them and 5% get through the mask, both my mask and your mask, my body can probably get that under control with my innate immune system, okay? It can't field literally, 100 tennis balls at one time or 100 mosquitoes at one time, a whole swarm, but it can probably take out most of the little ones that kind of get through. That's the whole concept of it. It's basically a viral load exposure phenomenon, and I can take out a few, but I can't take out 100 or 1,000. So, okay. So let's talk about the papers. One of them said with universal masking, not only would flatten the curve, it actually affected it more than a lockdown, which I thought was really fascinating. Gosh, I wish we'd known that 2-3 months ago. But Americans don't like to wear their masks. So if we had adopted universal masking at the very beginning of the outbreak, we could have actually even potentially eradicated this disease, is based on some of this modeling. Now, we'll never know. Hindsight's 20/20. I guess the lesson is if you do it in a stepwise fashion, it becomes less and less effective, all of your measures, and you get to the same endpoint, which is more deaths than were necessary. And keep in mind, some of this science actually preceded even COVID. So it's not even tainted by any conspiracy or anything, because a lot of them were 2008, 2013. A lot of it's based on medical science, trying to limit infections in hospitals, infection control, what we call source control. You put the mask on the person who could be spreading the disease, and that is called source control. And a lot of us are going to be pre-symptomatic or asymptomatic before we know it and could be spreading it to people, which means source control means everybody should wear a mask because we don't know who those people are. Okay, and again, the longer we wait to institute this or comply, the less it's going to help, and the longer it's going to be till we get back to normal. And I understand all you people that don't like to follow the rules. I get it. I'm one of you. So, but again, the last 2 times that I went out and the 2 times that I chose not to wear a mask, I felt very uncomfortable, and not because I've been brainwashed, but because I thought, you know what, my husband's still seeing patients, and granted, he's doing everything he can to protect himself, and I'm going to be taking more ER shifts soon, and we just don't know who we could infect. And so it just makes sense to protect everybody. So from now on, you're going to see me masking up. And here's the irony. At first, nobody could get masks. They were scarce. Everybody wanted masks. Oh my gosh, I need to get a mask. You couldn't get surgical masks. You couldn't get N95 masks. They were going out of stock on the internet. Everybody was crazy for masks. Now that you tell us you want us to wear them, everybody's like, I don't want to wear a mask. That's ridiculous. Really? Do you see the hypocrisy in that? That is crazy. So anyway, let's talk a little bit about the masks that are out there, okay? The most effective one is an N95 respirator. This is one of the round ones. This is not the ones you get at the store to stop allergy symptoms when you're mowing your yard, right? It's a particulate respirator. So it basically blocks particles that tiny viruses could hijack on, the virions could hijack on. It also blocks large droplets. They're rated differently. A P1 is the ones that those are the ones that involve oily vapors and things like that it would block it. That's what painters use, Body Shop, you know, people who are doing things with a lot of vaporized oily substances. The N stands for the particulate ones that don't involve oily substances. So that's just water-based vapors like what we breathe out. So this is an N95. You can tell because it says on here NIOSH. See that on there? Now, you can go to the CDC, and I think you can also search for counterfeit N95s to search and see, is mine legit or not? Because I can tell you right now, this one, this one's not legit. Because look at it. It says KN95 on it. Do you see all the tiny perforated holes that are in this mask? Really? This one, no holes. This one, lots of holes. Big difference. Don't walk around with this because it's just not going to do any good. Okay? In fact, that's worse than a homemade cloth mask. So now you have a surgical mask, which doesn't have the little wire piece on the top that's as thick so that you can fit it to your face. Because the whole idea of an N95 is there's no gaps in the coverage. They actually spray a little solution when they're fitting us for it to make sure we can't taste it. That's got like saccharin or something in it, I think. So now this one, again, this is not the proper way to wear this mask, all right? It needs to cover your chin, and it needs to cover your nose, and the tiny little thin wire that's in there needs to go completely like that. There are a couple little gaps on the side, but that's not as big of a deal as the nose. The nose has to be covered, and it has to go over the chin. You see people walking around like this? No good. Absolutely zero good. See people walking around like this? Absolutely no good. Better than nothing, I guess, but certainly not as effective. Now, I have lovely ladies in my life, my sisters-in-law and my mother-in-law that can sew. I cannot sew. I sew people. I cannot sew fabric. So they made something like this. You've probably seen me do this when I did a makeup video, but same thing. Homemade cloth mask. It's got a little, it's dual layer. It's a certain, it's like fat quarter heaviness for cotton. And this is great because I can do this with it. And at first I was like, why are people driving around in their car with their masks on? I don't understand. And I think it's because they don't want to monkey with it and have to retie it and refit it. I was like, I'm not afraid of myself in my car. But anyway, I'm having a hard time getting this one tied. See, that's the reason why. Okay, so this is great because it also has the adjustable strap. I can adjust it this way, and I can also adjust it from the back where that loop is. This totally covers everything. Now, one additional thing is there's probably need for eye protection. Glasses will help for large droplets, but if there's like a draft or air coming in that way, I mean, obviously you can see mine's fogging up a little bit, so I'll need to adjust it. But if there's a draft or anything like that, then what you're dealing with then is that, is that you want to do goggles or something if you think there's a high level for splash. And trust me, when we would be draining an abscess in the ER and you get all that gunky stuff that could spray or do whatever, we just use a simple surgical mask and a face shield, which was perfectly adequate to keep us from getting the goo on us, along with a gown over it. So, and trust me, when you're sewing at people or draining things and it's hot in the room and you're stressed because they keep crying, they're like uncomfortable and they're complaining and like a little child's crying and the parents are distressed, like it is a very stressful situation and it is hot in all that gear, 100%. But I wore it anyway because that's what you have to do to prevent infection from spreading and to protect yourself. And it's not that hard. It's really not that hard. It's just like one of the easiest things. So for me, my personal decision is to recommend everybody wear a mask. There is science behind it. I've got 6 or 7 papers here. Not all of them are from 2020 that talk about all of it. And I was going to say, where's probably the best quote? Hold on. I'm going to find it because I started it. That's right. It's at the very end of this one article. Hold on. Here it is right here. Social distancing and masking at both 50 and 80 to 90% of the population, but no lockdown beyond the end of May result in, beyond the end of May result in substantial reduction of infection with 80 to 90% masking eventually eliminating the disease. So let me repeat that because I messed it up. Social masking at both 50 and 80 to 90% of the population, but no lockdown beyond the end of May, results in substantial reduction of infection with 80 to 90% masking eventually eliminating the disease. So guys, we can do this. It's really easy and it doesn't hurt. So enjoy your 4th of July. Enjoy your freedom as an American. But right now we are outpacing every country in the world with our number of COVID cases. And pretty soon we're going to be outpacing with deaths if we're that high. So happy 4th and mask up. Take care.